Let's discuss hypercalcemia. Hypercalcemia condition in which serum calcium level exceeds 10.5 mg per deciliter means the calcium level is more than its normal value, that is more than 10.5 mg per deciliter. Let's discuss the causes for hypercalcemia. We know that vitamin D is necessary for calcium absorption. So to remember the causes of hypercalcemia, we can remember the mnemonic vitamin D. V stands for vitamin D excess. If there is increased vitamin D, increased absorption of calcium will occur, due to which hypercalcemia develops. I stands for immobilization, long term or bedridden. If a client or person is on long term bed rest, then bone resorption may increase, due to which increased calcium release into the blood. So hypercalcemia develops. T stands for thiazide diuretics. Thiazide diuretics reduce calcium excretion by the kidneys, so calcium builds up in the body and hypercalcemia occurs. A stands for abnormal parathyroid, that is hyperparathyroidism or adrenal insufficiency. Adrenal insufficiency is a condition of Addison's disease. In both these conditions, calcium balance is impaired, so there is increased calcium buildup in the body. M stands for malignancy, bone destruction from metastatic tumors. Due to tumors, bone destruction occurs, which releases calcium into the blood, and hypercalcemia develops. I stands for increased intake of calcium. If there is increased dietary intake of calcium, then also there can be increased level of calcium in the body than normal. N stands for neoplasms. We already discussed due to tumors, neoplasms, bone destruction is the cause for hypercalcemia. D stands for dehydration or decreased calcium excretion due to any kidney disease. If there is dehydration or due to any kidney disease, calcium excretion is impaired, which causes more calcium buildup in the body and the condition of hypercalcemia develops. So the mnemonic for hypercalcemia was vitamin D. That includes vitamin D excess, immobilization, thiazide diuretics, abnormal parathyroid and adrenal insufficiency, malignancies, increased intake of calcium, neoplasms, dehydration or decreased calcium excretion by kidneys. Let's discuss the clinical manifestations that will occur due to the condition of hypercalcemia. We know that calcium is necessary for muscles and nerve activity. So, if these activities are impaired, due to which more calcium is there in the blood as compared to in the bones. So, if there is less calcium in the bones, the condition of weak bones will develop. So, here the mnemonic is weak bones in condition of hypercalcemia. W stands for weakness, muscle weakness, fatigue, lethargy. As we already discussed, calcium is important for nerve and muscle function. So, in case of hypercalcemia, the neuromuscular excitability will be decreased, which causes muscle weakness, fatigue, lethargy. E stands for ECG changes. ECG changes including shortened ST segment and widened T wave will occur. A stands for abdominal pain or distension due to constipation. That means decreased bowel sounds or decreased motility of the GI tract. Arrhythmias, absent or diminished deep tendon reflexes. These conditions will also occur due to the decreased neuromuscular excitability because of hypercalcemia. K stands for kidney stones. Kidney stones will develop if there is high calcium in the body. More calcium in the blood, more calcium will go into the kidneys, which can develop kidney stones in the or mainly in the urinary tract, which is a condition of nephrolithiasis. B stands for brain symptoms: confusion, depression, memory loss, or irritability, anxiety, stupor, coma can develop if it is a condition of severe hypercalcemia. O stands for osteoporosis or bone pain. In case of osteoporosis, more calcium is released into the blood as compared to blood, there is decreased calcium in the bones. So bone pain will occur. N stands for nausea and vomiting may occur. E. Excess thirst and urination, polydipsia or polyuria. As we already discussed, that if there is abnormal parathyroid hormone, mainly the condition of hyperparathyroidism, it causes diabetes insipidus, in which there is polydipsia and polyuria. Due to polydipsia and polyuria, there is the symptom of excessive thirst and urination. S stands for stupor or coma, which will occur in the condition of severe hypercalcemia, and severe hypercalcemia is a life-threatening condition. So these are the clinical manifestations for hypercalcemia, which we can remember with the mnemonic weak bones, weakness, ECG changes, abdominal pain, distension, arrhythmias, absent deep tendon reflexes, kidney stones, brain symptoms, osteoporosis, nausea and vomiting, excessive thirst and urination, stupor, and coma. Now let's discuss the ECG changes that occur due to the condition of hypercalcemia. ECG changes include shortened ST segment and widened T wave. This is a normal ECG. As you can see, the P wave, the QRS complex, T wave, ST segment. So this is a normal ECG pattern. Now we will see the ECG pattern in case of hypercalcemia. This is the ECG pattern in case of hypercalcemia, which includes widened T wave. As we can see the difference in the T wave. The T wave in condition of hypercalcemia is widened and the ST segment is short. So these are the ECG changes that occur. How we will manage the condition of hypercalcemia? We know that hypercalcemia is a condition of increased calcium. So to manage this, we have to low calcium, means we have to lower the level of calcium. So the mnemonic for hypercalcemia management is low calcium. L stands for lots of IV fluids, mainly NS. We will administer large amounts of intravenous normal saline to promote renal excretion of calcium. O, that is osmotic or loop diuretics. These diuretics increase calcium excretion in urine, so we can give osmotic or loop diuretics. W stands for watch for ECG changes. We have to monitor the ECG changes for cardiac abnormalities. Next is C, that stands for calcitonin, reduces bone resorption. Calcitonin is a hormone that will lower the blood calcium level, because calcitonin will inhibit the activity of osteoclast, which was responsible. Osteoclast are the cells which are responsible for bone resorption. So if bone resorption is inhibited, then calcium level in the blood can be maintained. A stands for avoid calcium intake, dietary and supplementary. We have to lower or avoid the uh, restrict dietary calcium. L stands for look for underlying cause. We have to address the cause of hypercalcemia and treat accordingly. C stands for corticosteroids. We can give corticosteroids mainly in the conditions related to malignancies or neoplasms. I stands for IV bisphosphonates, inhibit calcium resorption. And we can administer IV bisphosphonates, which will also inhibit the osteoclast activity. So bone resorption will be inhibited and the calcium level in the blood can be maintained. UU stands for undergo dialysis. If it is a condition of severe hypercalcemia, that is a life threatening condition, and if the other treatments are unresponsive, means there is no change in the level of calcium despite some treatments, then ultimately we can go for dialysis to rapidly remove the excess calcium from the blood. M stands for mobilize patients. We have to encourage patient mobility to prevent bone demineralization, so that further calcium release into the bloodstream can be inhibited, which will reduce or maintain the normal calcium level in the blood. So this is the management for hypercalcemia, which we remember with the mnemonic low calcium. And for calcium, low calcium. It was lots of IV fluid, osmotic or loop diuretics. Watch for ECG changes. Calcitonin, avoid calcium intake. Look for underlying cause. Corticosteroids, IV bisphosphonates. Undergo dialysis and mobilize patient. So this was all about hypercalcemia. Stay tuned for easy explanation of other electrolytes in upcoming videos with Smart Mnemonics with SmartNurseGuide. Thank you.